Welcome to Adapting Class. Using common sense to beat the NCLEX fundamental section is actually one of the best strategy. Why? Because sometimes the test writers, okay, they try to trick you with complicated words, unfamiliar scenarios that you can't figure out. But the logic behind the question is actually straightforward. So here we go. We have 10 questions where I'm going to show you fundamentals of nursing. It's not that difficult if you use common sense to find the individual answers. The logic is the same. Stay safe. Let's go. First question, as usual, which action should the nurse take first? Prioritization 101. You have to be sharp, but at the same time, think about it. It's fundamentals. We're going to use common sense. A post-operative client is complaining of what? Increasing pain at the surgical site, right? What do you want to do? Go for the buzzword. Patient complain, fix it. If they complain about something, don't give it to anybody. That is what the NCLEX asking you. That is the what? The fundamental aspect of the question. Administer the prescribed pain medication, okay? Assess the surgical site for signs of infection, okay? Notify the healthcare provider immediately because the patient is complaining about pain, or document the client complaint. Test taking strategy. 10 seconds. Stop the video, answer the question, and see the way I'm going to approach it. I go to the buzzword. It's what? Fundamentals of nursing. NCLEX fundamentals. So what do you want to do? Common sense tell you, if I have a pain, I need to give the patient medication. But guess what? You have no clue what is causing the pain. Is it because they have surgery? Is it all because the wound is infected? Right? I know the patient surgery, complain about pain, but where is the pain? At the surgical site, right? Administer the prescribed medication without not assessing the patient is not an appropriate way to do this, right? Assess the area, make sure there's no infection anywhere, and then the pain is just physically normal post-surgical pain, right? Letting the doctor know it's not going to help you. Documenting means you're ignoring the client complaint. Giving the medication without figuring out what's the problem is not a good idea. Common sense, fundamental. So assess the surgical wound for signs of infection. Same thing. Which intervention is most important, right? A client with shortness of breath and oxygenation saturation of what? 89 is receiving oxygen via nasal cannula. What would he do? Intervention is the most important. All intervention is appropriate. Come back to the fundamentals of nursing. What do you want to do? Safety and don't cause harm to the patient. When you use common sense, you said, look, patient is getting oxygen already. His sat is 89. And what do I want to do? Is reporting shortness of breath. Do I give them more oxygen, increase oxygen flow rate? Do I elevate their head out of the bed or encourage the patient to take what? Deep breath and cough or prepare for intubation? What do you think? Once again, stop the video, answer it, and figure out, look at the way I'm going to approach it. Of course, intubation is the last resort. There's no evidence in the question telling you patient is actually an extremist. That means at the last end of the point of getting intubated, it doesn't look like that. It says shortness breath saturation is 89. It's not 50. Right? If you let them take a deep breath, you're making them do something, right? But there's something you can do. If you elevate, improve the mechanism of breathing because you're already getting oxygen, probably they will do better. Increasing the flow will not help the situation. There's something you can do first before giving them more oxygen. Patient already receiving oxygen. You keep on increasing the oxygen without any effect. Therefore, I will elevate this guy here. Common sense approach to fundamentals of nursing, NCLEX fundamental. What should the nurse do first? That means all options are available. And nurse provide a client on the, and then the nurse find a client on the floor near their bed. What should the nurse do first? You walk into the room, patient is on the floor. What do? Do you get the patient back into the bed? Do you call for help? Do you let the healthcare provider know? Or do you document the incident? What do you think? What do you think? Assess for injury, call for help, then you can do the rest, right? Helping the client to the back to the bed, you don't know if the patient is injured or calling for help, then it's appropriate way. Then you assess the patient, you bringing in more people to help you take care of the patient. The provider will ask you, what do you see? You're not talking to the patient. You're just calling me for what? Do your job. Documenting the finding is not always. Always safety before reporting and then documenting. Safety, reporting, and documenting. Provide safety, reporting, and documenting. That's the procedure. Therefore, I'll call for help. Which client should the nurse assess first? Prioritization 101. You got to be sharp. If you don't watch my videos and be sharp, please, I encourage you to watch it. Patient blood pressure is 140/90. Should you worry about it? You saw a patient who is wandering in the hallway. Should you worry about it? Your patient is scheduled for discharge tomorrow. Should you worry about it? Patient is requesting extra blankets. These are fundamental questions I put it. I try to make it straightforward as much as possible. At the same time, critical thinking and using common sense. What do you want to do? Safety, like I told you, before reporting and documenting. Patient wandering in the hallway, safety first. Get him somewhere. Is he confused? There's a risk of fall. I don't tell you anything about an old patient should be wandering on the hallway. Therefore, number 2 is the right answer. The client is prescribed IM injection in the deltoid muscle. Which action is the most important before administering? Rewrite the question. Figure out what is going on. Buzzword, prescription for IM injection. What would you do? What important step would you take before giving the medication? Explain the procedure to the patient. Investigate previous response to similar medication. Assess the injection site to make sure there's no infection or swelling. Confirm the medication dose with another provider, which is the nurse. What do you think? If you are in that situation, think about common sense. I have to inject the medication to a patient. Do I explain the procedure to them or assess their response to previous similar medication or check the area for signs of redness or swelling or let the nurse confirm that it's appropriate? The most appropriate and safe and the most important is what? Checking for allergy. Do you see any allergy there? Yes, there's allergy there. The medication, always check for allergy. But I do not put allergy there because you will take it. This is what the NCLEX writers will do. They take the answer choice, put certain word there to confuse you. There's allergy there, and that's number 2. Investigating previous response to similar medication is checking for allergy. So that's the right answer. When teaching a client about new medication, which is the best nursing action? If you're teaching a patient right now, which action is the most important? A new prescription. What would you do? What would you do? Let's use the common sense approach. A new prescription, you're teaching the patient about it. What do? Do you think they need a detailed information about the medication? It's not going to help them. Simple language, check the understanding. If only 2 words you're explaining to them, they're more likely to absorb them. It's the way you teach a patient. Tell them to read the medication. Does not answer the question. The question say what? Teach the client. Therefore, asking them to read it is not appropriate. Inform the client about the side effects. The same thing as number 1. It's enough. That teach, let them respond, figure out if they understand. Once again, common sense approach to fundamentals of nursing is a lot of work. It's a lot of topic you have to memorize, but always remember safety, report, and document. Safety, report, and document for fundamental. A nurse administered the wrong dose of a medication to a client 2 minutes ago. What is the nurse's best initial action? The word said initial. Initial, all the answers are right. But which one is the most important? Initial step you should take. Complete an incident report. Notify the risk management department. Obtain client vitals. Inform the charge nurse of the error. Think about it. I give you the clue. I told you safety, report, and what? Document. You see that answer trace? Every fundamental. Think about it. Safety, report, and document. Fundamentals of dancing. This is the key, right? You give a patient medication now. Is it wrong dose? What do you want to do? Assess the effect of the medication on the patient. The safety question on NCLEX is not about you. How is the patient doing? Always, when you see it, how is the patient doing? This patient is not doing okay because you give him a wrong dose. Writing about incident report, you're thinking about yourself. Notify the risk management, you're thinking about yourself. Obtain the client vitals, you're thinking about the patient. Informing the charge nurse, you're thinking about yourself. Therefore, patient before self. Patient before self when it comes to safety. This is the key. The right answer is obtain the client vitals. This is the easy way I can explain safety questions on fundamentals. A 3-year-old child arrives at the emergency department with bleeding laceration to the left hand. The nurse observed injuries that raises suspicion of the child abuse. You think there's a child abuse. What is the nurse priority action? What do you want to do? Call the doctor or notify them, apply pressure to the wound, report the suspicion to the charge nurse and the local enforcement immediately. You see, it's the same question we saw number 7 in the different way. I told you the NCLEX writers use these little ways to and trick you, but the concept is the same. It's the same concept right here, the same standard right here. Child comes in, you suspect abuse, but what is happening? Patient is bleeding. Patient is bleeding. Patient is bleeding. Fix the bleeding first. So patient before you, because when you call the doctor, you're trying to take care of yourself. That you notify the doctor. When you suspect, you report to the charge nurse, you're basically doing your function as what? Mandatory reporting. When you contact the local law enforcement, mandatory reporting. But when you apply pressure to the patient, you apply client needs, fundamentals, client needs. Therefore, number 2 is your best answer. You see this question, same thing as number 7, same thing as number 6, but change it. This is the same thing. Safety, report, and document. And next, note that a client IV site is swollen, is red, and is painful. That means bad stuff is happening to the patient. What is the next best action? These are all signs of what? Infiltration of phlebitis, basically bad stuff. What do you want to do? Document the finding that this happened to save yourself, document, discontinue the IV, and start a new one. You're basically helping the patient. Safety. The key thing is whenever you see infiltration or phlebitis or something like that, you have to stop IV fluid from there. Apply heat to the IV site. It's not appropriate right now. You're treating the problem without not fixing it. Notify the air care provider. Once again, it's not going to help you. Fix it. Number 2 is your answer. Common sense. And the last one, same thing. Last one is a broad common sense questions. It's a common thing you would do with intervention. The patient with the urinary catheter reports lower abdominal discomfort. He has a Foley catheter. He's complaining about abdominal pain. What should you do first? Empty the catheter drainage to make sure it's flowing. Check for kinks in the catheter. Increase the client fluid or obtain bladder pressure. All the answers feel really, really good, right? But think about it. What would you choose? Do you empty the bladder? Do you check for kink or increase fluid or obtain bladder scan? Let me show you. Common sense way. If I obtain bladder scan, I'm still not, you're trying to get more information, trying to do more assessment. But the patient tell you what? I have lower abdominal pain and I have Foley catheter there. The assessment has to be directed to the Foley catheter. Why would you have abdominal pain if you have Foley catheter? Unless it's not working, unless it's not flowing, there has to be some obstruction to make your bladder bigger. Obtaining scan, you're looking for fluid. You don't know where the fluid is coming from. Increasing the client fluid, what's in the situation? Checking for kink will tell you there's a blockage. That's why the abdominal pain is happening. And when you empty the Foley bag, you have to check for kink. You have to make sure the Foley bag is working. And therefore, number 2 is a better answer. 10 questions, testing your fundamentals and how you approach it. You beat it with common sense. No matter what kind of question they ask you, you may not know. It may be IV fluid. It may be anything. It may be enema. Watch for the key concept because it's the same thing. Thank you for watching. Good luck in your exams. If you like this video, share. There's a playlist with this. Oh, I have a bunch of playlists that you can watch them to master your content. Thank you for joining Adapt NCLEX, and thank you for subscribing. Take care. Bye.